Good afternoon, teacher. I will tell you a topic, erythropoietin for neuroprotection in preterm infants. A high dose of erythropoietin has been shown to have a neuroprotective effect in preclinical models of neonatal brain injury, and a phase 2 trial have suggested possible efficacy. However, the benefits and safety of this therapy in extremely preterm infants have not been established. The definition. The Pretern erythropoietin neuroprotection trial of phase 3 randomized a placebo-controlled, double-blind trial to assess the safety and efficacy of early high-dose erythropoietin for neuroprotection in extremely preterm infants. Enrollment and initial administration of erythropoietin or placebo occurred within 24 hours after birth. Infants receive erythropoietin a dose of 1,000 U per kilogram or placebo intravenously every 48 hours for a total of 6 doses.
Anytime that you were born more than 4 weeks early from your due date, which is 40 weeks of time in the uterus, then you're defined as being born prematurely. The children that are at greatest risk for problems, including cerebral palsy or major learning difficulties, are those who are born very early, and that's more than 12 weeks before their due date. From current literature, we know that if you're born from 22 weeks, i.e. just over halfway through the pregnancy, you can survive. So many of these infants now survive, but unfortunately go on to face later challenges.
Applications in medicine. We didn't observe that treatment with high-dose erythropoietin in extremely preterm infants result in a lower risk of death or in better neurodevelopmental outcomes at 2 years of age than placebo.
MRI images at term equivalent age. The one on the left is the MRI from a 30-week gestation infant, so obtained about 10 weeks after birth. And the one on the right is a 23-week gestation infant, so again obtained on comparable age. And what you can see with the 23-week gestation infant is this diffuse atrophy. You can see the enlarged ventricles. You can also see the extraaxial fluid collection and a diffuse white matter as well as gray matter injury. So this is the sort of brain that we are seeing at the term equivalent age. There is going to be continuous repair beyond the term age, but this is probably what is responsible for the long-term neurodevelopmental problem. As against the preterm.
Pros and cons. Pros. Erythropoietin, which is used clinically for its erythropoietic effects, is also an important therapy factor in fetal brain development. Erythropoietin has been shown to have neuroprotective effects in preclinical models of neonatal brain injury. Cons. The key secondary outcome was death or moderate to severe neurodevelopmental impairment. Moderate to severe neurodevelopmental impairment was defined as moderate cerebral palsy. We recorded the incidence and severity of common sequelae of prematurity, bronchopulmonary dysplasia, intracranial hemorrhage, periventricular leukomalacia, culture-positive sepsis, any stage of necrotizing enterocolitis.
COPD can result in needing oxygen and maybe even the ventilator for long periods of time, months, sometimes even years. Our approach to ventilation in this unit is really based on a lot of studies that have been done in the lab. We've been able to turn a baby who is very sick into a baby who's very interactive, developing normally. Patients with BPD can be very complex. We've learned a lot. For example, we used to use a lot of oxygen, but we've learned that using too much oxygen can be just as bad as using too little oxygen. We've also learned that it's important to ventilate the lungs in a certain manner to make sure that we optimize lung function. And so we've been able to take that from the lab to the clinical setting. Now we actually have 99% survival. We come up with the very best plan that seems to fit all of the aspects of the patient.
Issue of planning nuclear. A big problem in nuclear is teenage pregnancy, which often does not end up damaging the life of their children. There are too many causes that the government does not provide itself with care or prevention to reduce the mortality rate of premature children. If it is an underdeveloped country, therefore, there are still not methods that help improve the quality of life of these babies.
Tatlo po. Ang panganay ko po ay magdadalawang taong gulang. Ang pangalawa po, namatay.
Nung nalaman ko nga yun, edi sinaktan ko siya sa galit ko. Talagang sinampal-sampal ko siya. Kung ako lang hindi ko tanggap na magbubuntis siya ng bata pa. Gusto ko mag-aral siya, kaya sa galit ko, nasaktan ko siya.
Nabuntis ako ng unang anak, 13 taong gulang. Nung nalaman ko po na buntis po ako, tinanggap ko na lang po. Kaya tanggap na lang ang naramdaman ko dahil wala naman po akong magagawa. Nag-aral po ako ng grade 8. Wala naman pong naturo sa amin na birth control. Kung alam ko lang po ang birth control, gagamit po ako nun kasi para
problems. The majority of the babies will have issues relating to breathing and feeding. The smaller the baby is or the more premature the baby is, every system in that baby's body is immature, from the brain to the kidneys to the liver to the intestinal tract, and they can have unique and life-threatening problems with each one of those systems. In particular, infection is a big problem in the very tiny premature infants. But the majority, it's breathing, have their lungs fully developed, or is there some extra fluid? Once that's improved, then we work on feeding. There's a reflex that develops in babies to allow them to coordinate sucking, swallowing, and breathing. Typically, that reflex begins to develop when the baby's around 35 weeks inside mom. So when they're born at term, they're ready to go. So depending on the level of prematurity and where they are in the development of that reflex really determines how well they're going to feed once their breathing problems are under.
Finally, the conclusion. A high-dose erythropoietin treatment administered prematurely preterm infants from 24 hours after birth through 32 weeks of postmenstrual age didn't result in a lower risk of severe neurodevelopmental impairment or death at 2 years of age. Thanks for watching my video.